Welcome, Dr. Shetty, to yet another episode of Editor Speak. Sir, over the past few episodes of Editor Speak, I have realized that patient information, particularly medical history, is a critical part of the treatment regime. It results in better treatment decisions and better treatment outcomes. But does it have medico-legal significance?
Definitely it has. As you rightly said, medical history is most vital in patients' management, especially in cases of comorbid, critical and high-risk patient. More than the history given by the patient, it becomes mandatory on the part of the doctor to elicit what has been left unsaid, as it can have medico-legal consequences.
Sir, having said that, one doubt that comes to my mind is what if patients themselves, knowingly or unknowingly, try to hide their medical history? As a doctor, you must have come across patients who don't want to share information.
Indeed, a good question. See, Preeti, it's a human nature, and a few of the patients can get insecure while opening up about their medical history, thinking it as a private matter or unaware of the importance of the question in this case. This has been best demonstrated in a recent judgment from the National Consumer Commission, where a child with a swelling in the buttocks, having treatment over a period of 10 years, having visited multiple consultants, investigated and diagnosed as a neurofibroma. The patient was brought to the vascular surgeon, who diagnosed it as a case of AVM and advised AVM embolization. During the intervention, a small amount of glue entered the artery, leading on to a gangrene of the right leg, for which an above knee amputation was performed in another hospital. The relatives of the patient filed a case of negligence against the vascular surgeon. The defense taken in this case was that the patient and her parents had consulted with several doctors for her ailments, a medical condition that had developed gradually over a period of 14 years. But this medical history was concealed from the vascular surgeon. Had this fact been known, the vascular surgeon would have postponed the intervention. The court held that there was no reason for the patient or the attendants to hide anything from the doctor. In fact, the court observed that since the surgery was high risk, and I quote, it was even more imperative for the OP vascular surgeon to elicit the necessary responses with specific questions with respect to the medical history and associated conditions of the patient, unquote.
So we are clear on the medico-legal aspect of patient history. Sir, what learnings can you give for the doctors from this discussion?
We have not come across a case where the court has so emphatically stated that it is the doctor's duty to elicit proper history. My advice would be that doctors should form questionnaires tailored to specific risks, complications, complaints, signs, symptoms, and needs of the patient in order to elicit requisite responses with respect to the medical history of the patient. This will help in taking informed treatment decisions and arriving at appropriate diagnosis.
Thank you so much, sir, for your valuable inputs. Let's conclude on a positive note. It is the duty of doctors, not the patients or their attendants, to elicit complete and correct medical history. This will help in providing a high standard of care. Thank you.